Hi, Ian from Insightful Products. I'm looking forward to sharing some analysis that we've done using 3D rendering. Now 3D rendering is possible because Curvebeam has put together a system that allows us to peel away the skin and the soft tissue and look at what's happening inside the foot. And it's not just slices, say like an X-ray where you can slice through, but it's an image where you can rotate and you can see various angles and really get a better understanding of how the relationship of the different bones are manifesting within a particular patient. And what we found at Insightful Products is that it's not just a medial instability issue every time. That is, medial instability can be described by a podiatrist as posterior tendon dysfunction, posterior tibialis tendon dysfunction, could be described as posterior tendinitis, tibial tendinitis that is. By the orthotist it might be in something called an IRD, internal rotary deformity, PT might call it flat foot. But what we found in Insightful Products is none of those definitions really give us a complete picture of what's going on. And after seeing thousands of feet, we noticed, hey, you know, there are different categories and we can distinguish the different categories. And especially using this new tool, 3D rendering, we can better understand what it is we're dealing with. And if we have a better understanding, or we've distinguished it a little bit better, then of course we can manage it equally better with our braces. So that's what we're here to share with you now. And the first one that we're going to share is the lateral foot dislocation category. And that we figure it must be due to the deltoid ligament failure. And the deltoid ligament is a broad ligament that attaches from the distal part of the tibia to the hind foot. And when that fails, the whole foot kind of goes laterally. Check it out.
Part of the goal of this exercise is to start to understand what's happening internally by the shape of the external features of the foot. Here you can see a foot that's laterally dislocated. And from the top, you can see that the weight line comes way medial from where the calcaneus is. There's a lot of calcaneal valgus, and the whole weight line is coming through the tibia onto the talus in a medial way. So what we suspect with a foot like this is that there's a failure in the deltoid ligament. The deltoid ligament, which attaches from the medial malleolus to the bones of the hind foot. And when this stretches, the whole foot goes laterally, and you can see there's also some forefoot abduction here.
I hope you enjoyed that. It's pretty interesting when you see what the foot looks like on the outside and you peel away and you can start to see what the bones look like on the inside. So if you want to see more, click here.